since the heat event of last summer. So specifically related today to the lived experience of those populations that are most impacted by the heat. We'll be sharing some of the findings of a project that Lily and I and many, many others with lived experience were involved with about their experience of extreme heat. And there were some sharing circles that were done earlier this spring. So we'll share some of those findings. There's also an opportunity to hear from you to discuss what you've observed and the experiences of some of housing providers that are here today, but also the experiences you've witnessed of some of those populations you support during heat events. And then we'll also have some time to talk about opportunities to involve and support populations most at risk. And we're really lucky also today to have from the city of Kelowna, Stephanie Martin and her colleagues, Elaine and Sherry, who are part of a lived experience project there called a project to end homelessness called Journey Home. And they're going to be sharing some of their experiences from last summer's heat event as well. So we have an hour and a half together this morning. We'll get to some introductions in just a minute here, and then we'll have a couple of presentations. So one from Lily and myself, and then one from the Journey Home folks from Kelowna. And we'll have some time for discussion after each presentation, but we'll also be having a small group discussion where we hope we can hear from many of you before we come back together and share some new tools and resources and some updates around how you can be supported and share some new frameworks that the province has put out in the last few months. So just a few really quick Zoom reminders. You've already heard from Courtney that we'll be sharing some things in the chat today. So if you have that chat open, we invite you to use that to also ask any questions throughout the session. So any feedback or questions that you have, we'll be watching that. And then we'll be putting some links in the chat to link to some of the reports and projects that are being talked about today. And just one more quick tip before we get started. I know that there are a number of you joining from nonprofit housing providers, and then there's others that are staff with BC Housing. And so if you are a staff with BC Housing, if you could just take a minute to rename yourself and put a B in front of your name, that would be really great. And that will help us to ensure that we're distributing people from BC Housing in the breakout rooms and have some good distribution. So to rename yourself, you just hover over the image of yourself. There's a little button with 3 dots that should pop up. If you click on that, there's a drop-down menu and there's an option to rename yourself. So we wanted to get started with some introductions today. And to do that, I'm going to put a link in the chat. So that's probably the easiest way to join a live poll. And the other way is if you have a phone and you'd like to just do a screen, scan the code on your screen. That's another way you can join. So I'll just put the link in the chat here. And I'll stop sharing this. We can bring that up. Hold on one second. Great. So if you've opened up, so the first question is, where are you joining from today? And I will share that. Whoops, so we can all see that together. Hold on a second here. There we go. Great. So we have about half of you from the Lower Mainland, but then quite a few from the interior, Vancouver Island, and then a few from Northern BC and the Kootenays. So welcome. It might be Lily in the Kootenays, but maybe there's some others. So welcome. Great to see some representation from across the province. Great. So the next question is do you provide housing services and supports in a large urban area or a medium urban center or in a rural community? And if you provide supports to all three, feel free to check all three. We just wanted to get a sense, knowing that in a lot of what we'll be talking about today, there were quite different experiences of extreme heat in rural communities versus urban centers. So great to see that there's some representation from all three today. Great. So lots from medium urban centers and large urban centers, and also quite a few from rural communities. So that's great to see. We also wanted to get a sense of which populations you are supporting. So again, if you're supporting all of these populations, feel free to click all of them. But these are some of the populations that we engaged with in our sharing circles, and also some of the populations we know that are most impacted by extreme heat. And if the populations you support aren't represented here, please feel free to just jot that in the chat, which other populations you might be supporting. Great. Yeah, it looks like quite a few others. So yeah, I'll be curious to look in the chat and see what other populations are being supported today. And the last question here, just getting a sense of what you think to the extent that extreme heat has impacted the populations that you support. And some of you might have buildings that have air conditioning, so it might be more moderate, and some might be supporting or working in buildings that don't have air conditioning or are more exposed to heat. Yeah, so it seems like a great deal is by far how you've noticed populations are being impacted by heat. Okay. So thanks for that. I'll leave the poll open, and we are going to jump back into the presentation. We're going to just start by talking a bit about the project that Lily and I were involved with. So I'll just share my screen again. Great. So yeah, we're going to share some of the findings from the project, but first, just to reorient ourselves to last summer, which we're in a heat event right now. Last summer, I'm sure that we can all remember the unprecedented temperatures we faced, and that there were temperature records broken across the province. So that was really the catalyst for the project that Lily and I were involved with, along with many others from across the province, partners who work with populations that were really impacted by heat. And it was commissioned by the Climate Action Secretariat to better understand what the lived experience of those temperatures were. And while there was a lot of data being collected on some of those devastating health impacts, the data wasn't necessarily telling the whole story. So that there was a need to hear the experiences and the stories of those that were really impacted, and then use that information to improve heat response. And we know that those that were most impacted by the heat were really those that are equity denied. So that's a term that really explicitly acknowledges that certain groups are systematically excluded and denied access to social benefits. And we know that in the case of the heat dome from last summer, that there was a disproportionate amount of those that died from the extreme heat event that lived in economically deprived neighborhoods. Over 90% of the deaths were for people that were over the age of 60. Nearly all the deaths, 98%, happen indoors, so in places that did not have adequate cooling. And over 90% of those that died last summer from the heat dome had at least one chronic disease, over half having mental health challenges, and over half lived alone. So it just goes to show that there are some patterns here, and they really are pointing to populations that are really that were equity denied, and that inequity was being exacerbated by the extreme heat. So the project, the purpose of the project was to engage with those populations that were more at risk to heat, so heat vulnerable, equity denied individuals, and really provide an opportunity to hear their lived experience, but also was to identify opportunities and barriers faced by those systemically marginalized populations in relation to extreme heat, and to help inform the province's work to improve preparedness and response. So we did 4 sharing circles. There was 28 participants that participated in sharing circles. Those were hosted in person as well as virtually. There was a number of interviews that took place with service providers, as well as some people with lived experience. And then there was a service provider workshop as well with 43 participants. And then 2 surveys were also held or conducted, one with service providers, and then a survey specifically for people with disabilities was administered as well. There were 3 priority populations that were engaged with this project, and they were determined to be kind of at risk to heat. So that were people with disabilities. So that was a sharing circle with urban populations from the Lower Mainland and Vancouver Island. Socially isolated and economically marginalized seniors. So that was a combination of urban and rural populations from across different regions in BC, and that was a sharing circle that took place virtually. And then there was a third population group of people who were unhoused or insecurely housed, and those also were having intersecting populations with those who experienced mental health or substance use challenges. So there was an in-person sharing circle that took place in Greater Victoria, as well as a rural sharing circle that took place from different regions in the Kootenays. And we'll talk a lot about some of the differences between rural and urban in this presentation as well. And the last thing I'll just share before I pass it to Lily is that the approach we took was really trauma informed. So really treating people with lived experience as experts, and really grounding our approach in empathy and dignity. But we worked a lot through, through existing relationships and networks of service providers. So they were the organizations that had the trust with and relationships with people on the ground. And so we really couldn't have done this without them, and worked with them to help organize the sessions. All the participants were compensated for their participation, recognizing their experience as expertise. And then we were also extremely grateful for a number of reviewers who were people with lived experience themselves, who provided invaluable review and feedback on the report findings before it went forward. So I'll turn it over to you, Lily, now, and I'll just advance the slides if you just want to let me know when to do that.
Absolutely. Thank you so much, Vanessa.
Oh, Lily, you're frozen a bit. Lily, we can't hear you, but why don't I start, and then we can try and get you unfrozen. That works. Okay. So this first slide is just speaking to some of the cross-cutting barriers that we heard in the lived experience sharing circles. And certainly there's a number of quotes throughout these slides. And oh, Lily, can we hear you now? Oh, maybe if we can turn off your camera, that might help. Hi, Lily. Oh, you're on mute now. There you go.
Can you hear me now?
Yes, we sure can. So
my apologies. I don't know. The timing was just perfect for that not to work. So, thank you. Grateful to be here. Did you cover this slide or not yet?
I have not yet. No, go for it.
All right. So yes, first and foremost, as Carrie said, I would like to acknowledge all the people, and I think it was over 100 people that contributed to this study. It was an exceptional experience for us as facilitators as well to be part of this. So we're really grateful to be sharing this today. We'll just be sharing some of the key highlights. So I believe all of you have the report, which was in the registration link, and I really suggest that you walk through to really get the stories and the voices from that report. So there were some of the cross-cutting barriers that came up throughout the circles and throughout the service providers' engagement. And I think that was a really strong finding that service providers really know where the needs and the assets are within the lived experience piece. So that was a really strong key takeaway for us. So what are some of the themes that came out? Those people that need help the most are least likely to seek those services, emergency services. So this was really universal throughout the sharing circles. There were tensions with law enforcement. There were tensions with filling out forms in fear of child apprehension and things like that. There was a very strong difference between rural and urban communities in how they experience heat. And it was very purposeful for our team to really look at that as a lens, because it's something that's often omitted and people focus on urban areas. As you all know, I don't need to go in depth into that. The emergency response system was overloaded. As part of the workshop, the service provider workshops, we had some of the witnesses from the province and from emergency response services, and that was really beautiful testimony where they really shared to what extent these services were nearly failing, right? So it was a huge lesson provincially. there was a real lack of coordinated support within municipalities, right? There wasn't the clarity who's responsible for this piece or that piece. So that coordination piece and communication in general was definitely one of the key findings. And overall, there was this massive strain on service providers, both rural and urban, in urban settings, in terms of the interruption of support from caregivers, mobility challenges. It was a long weekend. There was a number, just plain logistics, that really got in the way of providing services during that heat wave. And what are some of the lived experience voices, right? So there is limited green shady spots when you're homeless. It's hard to find a place when you can be where you can be without someone giving you a hard time, right? So that was really another strong finding. Like, we talk about indoor spaces, but that some of these people live outdoors, right? Like, and which of those outdoor spaces offer safe spaces during the heat event? Throughout the engagement, there was a strong sense of surprise. The heat wave really caught everybody by surprise. It felt like, as one service provider said, it felt as though there wasn't much planning. It was all response, minute by minute. And in terms of the actual impacts, how did the people feel through this? So this is Simon from Disability Sharing Circle, and this is what he said. I had nausea and migraines. I couldn't get away from the heat wave. I threw up a bunch. The heat was inescapable. It was a nightmare to deal with. I hope no one ever has to go through that again. It was like a prison within your own home. So these voices were very critical for the project, and we're very grateful for everyone who shared their experiences. Housing, as you know, and I'm grateful that we're having this webinar today, housing is #1 protective factor when it comes to priority populations experiencing heat. Thank you, Gary. So the province actually gave us, so Climate Action Secretariat gave us 4 specific areas that they wanted our team to look into. So that's how our presentation today is organized. #1 was access to cool places. And some of the surveys the results that we received were basically universal agreement that people really lacked access to cool indoor spaces during the day. And they also lacked access to shaded outdoor and green spaces. So this is something to take into consideration as you move forward with planning. What kind of cooling places and how can they be best designed? Within the lived experience group, less than 10% of lived experience participants knew about, had access, or used designated cooling centers. And this is actually one of the key findings. You know, within the emergency management, it's often, or public health and so on and so forth, right? It's often the first measure that's put forward. Let's open these cooling centers. Well, who uses them? Are they used? Are they useful for these people, especially those that need these safe environments? What were some of the barriers? Well, getting to these centers was a significant challenge. In rural areas, each one of those centers is like an hour away, was at least an hour away. People didn't know about them. And then the space in general wasn't welcoming, wasn't entertaining. You're in this brightly lit room. There isn't much to do. Some of the examples that really worked were those avenues that people already knew about. So the avenues that they already used on a daily basis, like the senior center that just had a cooling room, for example, and there was food provided, there was social element to it. So those things have really worked. But just an institutional, brightly lit environment with air conditioning, those were not used. For unhoused people, this was a specific finding. There is a stigma, right? Like as one person said, the issue is you can't leave your things to go to a cooling center. Who's going to watch your stuff, right? They can't take their shopping cart, for example, in the cooling center. So there are a number of logistical barriers and stigma barriers that were experienced. So what are some of the key takeaways moving forward? Really creating those inclusive and stigma-free cool spaces, both indoors and outdoors. You know, in rural region, what we heard, you know, like they just simply don't have air conditioning. So one of the things they were thinking about maybe misting stations or even just providing water. So in one of the, working with one of the service providers, basically, one of the key services is food bank. So across the rural region, a number of people come together every 2 weeks, and they were waiting in a dusty, hot parking lot. People were getting angry and kind of aggressive and short with each other, right? So they were thinking like how to improve that, a misting station, right? So some of the low cost measures as well. And really to think about investing into cooling infrastructure broadly, not just the cooling center. So that's one of the really important takeaways. Here are some of the other quotes, and we're welcome to read them in the report. Yeah, thank you, Carrie. We can move on to the next slide. Another theme that we were asked to look at was mobility and transportation. And really, this was such an important theme to look at. For seniors, for people with disabilities, for unhoused, across the lived experience, this was a major barrier. And this is from the service providers workshop. Again, 80%, 81% believe that mobility and transportations were presented barriers to the population that are being served. So it's actually a significant hit risk factor. You know, if you are a person with disability, just walking in one of the sharing circles, the lady actually walked us through what it would take her to move from her home, to get to a bus stop, to get on the bus, and to get to a destination like a cooling center. There wasn't shade on the sidewalk, so she just, as she walked us through that, walking with a walker and the medical issues that make her particularly heat sensitive, it was really obvious this is not an option. So she stayed indoors, and most people did. You know, especially if you're a person with disability who's also caring for a grandma or something like that, like Emily shared here, they just had to stay indoors. And what they found out that the temperatures were in 46 degrees without air conditioning, small apartment. Some of the, for rural participants, and this is where the project focused on heat explicitly, but because the rural area that we, in the Kootenays that we worked with, just went through a massive, right after the heat event, they went into a massive wildfire event. It was one of the wildfire of note areas with 7 weeks of really dense smoke. It was really difficult for participants to separate the two. And they were saying that, you know, it's a crucial safety factor. So one of the interviewees in Securely Housed, she was a mom in between homes. She has 4 children, and she was 8 months pregnant at the time, living in a yurt. So they barely managed it through the heat wave, and then the wildfire hit. So her vehicle didn't have enough gas to even get out. So they were running around. They live kind of in the back country, running around trying to find $20 just to get to safety as the evacuation order was put in place. And some of these areas don't have self-coverage either, right? So those were some of the transportation challenges that were faced. Transportation challenges were also faced by the service providers. So, you know, with fuel costs going up, with the priority overstretched capacity and lack of securing volunteer drivers, for example, for food delivery and so on and so forth, that was also a major barrier. Next slide, please. So key takeaways. Lack of mobility is a significant heat risk factor. So it's something that definitely needs to be taken into account within your planning policies. Affordable, accessible, and cool. So some of the ideas that people talked about is like making sure that all buses are air conditioned. So as you're getting from A to B, that you have access to that cool space en route, or giving free bus passes, for example, so that people can get on the bus and get cool at least during that time. There are very distinct needs between transportation, just the distances, right? Like a senior spoke about that heat wave. On the first day of the heat wave, they had a heart attack on a side of the road, the hospital being over an hour away, right? So, and the air conditioning failed and the car broke down. So those are the kind of experiences that people went through. The local conditions really have to be taken into account when planning. As I mentioned, utilizing mobile cooling centers, what this could look like, you know, so that the bus is always cool when people can get on and find their destination, get to a destination more safely. Communications, and this is, I work primarily in the realm of emergency management. And if you look at every single after action report, the number 1 thing always is communications. Number 2 thing is always communications. And number 3 thing is always communications. So similarly here, this was the area that required the most improvement, and that was universally agreed by lived experience and service providers. There was complete lack of coordinated communication about heat risk. What are some of the thresholds for actions? What are the things to look out for, right? Where is the heat alert and things like that? There's been a lot of work done on that, and you probably, all of you received heat alerts on your phone. Yes, and we'll probably take the questions at the end. Thank you so much, but please put them in the chat as we move along. That's excellent. There are very distinct needs when it comes to priority populations in terms of their preferred methods of communication. So the senior sharing circle said that, you know, the most effective thing probably would have been a phone tree. So directly from somebody you trust, getting a phone message saying, look, this is what's happening. You know, this is something that needs to be done. For this insecurely housed, you know, either a laminated card or basically something very physical present, like a poster in the areas that they frequently use, that would be the only way to reach them. These people don't have phones. They're not necessarily attached to the service provider, right? So those are the kind of methods that would need to be used. Another really important thing that came throughout engagement is this need for empathy-centered, heat-specific public awareness campaigns. So this is a big role where media can play. You know, there are certain populations like the people insecurely housed, the homeless people, or people experiencing, like, for example, one of the people that I interviewed, they were diagnosed schizophrenic, and they were talking about the issues that they went throughout the heat event, right? Because of thermal regulation and all of the different issues and medication that makes the things exacerbate some of the things. So really focusing on lived experiences in the media and walking through the experiences that people have been through, that's really important. Service providers are key trusted communications pathways. So really working and engaging them in getting the information to priority population. And really funding heat communications would be a really important pathway. And this is Meredith, a quote from Meredith, who is a severely diabetic transgender woman. She said, because of my medication, I cannot be in the sun. I do know better than to be in the sun, but not because anybody told me. I read it on the medication bottle. I spend a lot of time in the bedroom, in the dark, in the summer, and that impacts their ability to secure income, right, during that time. And that was another thing for, especially within the rural securely housed homes participants, employment as a protective factor. So having some kind of job indoors would have made a huge difference for those people. All right, and when we look at what are some of the best ways of reaching service providers, this is in terms of communication, and obviously direct communication, email, phone call from participants or networks, that was the most effective way to reach people. As you can see, the other ones like the alerts and social media and local government websites, those weren't quite hitting the mark. So there is improvement needed in that area. Really critical, and I'm so glad we got to explore this because it was definitely a major theme in terms of community and social networks as a protective factor. So what are some of the forms of connections that provided, as Carrie mentioned, a lot of people whose life was lost in the heat wave were socially isolated. There was COVID, there was long weekend. These are people that have a number of issues, health issues, and they're elderly and living alone. So those kind of informal networks, somebody looking after you or just giving you a call, they were proven critical. So we heard that from seniors, we heard that from the disability circle. The unhoused was very different just because of their lack of access to services, right? Like, and they're really in the rural, really scattered throughout forested areas and things like that. So there is a lot of improvement needed there, especially one of the things that happened, for example, in that Kootenay region, the Wi-Fi service provider basically took out their, it was a local company, they took out their equipment out of harm's way. Basically, at that point, these people had no access to any internet or any communications, right? So this was a huge gap for authorities. How do you even reach these populations? Being connected to advocates, and we probably have advocates on this call, this is really important. So the voices that come and tell these stories in the media and to the government, this is really important space and supports from service organizations. There were significant forms of social isolation. So, you know, and this is like in the rural area, again, really large distances to reach any of these services, right? Like, for example, if you don't have a phone or you don't have a car, you're not mobile anymore, right? Like just going these places, if you live alone, is a huge challenge. And here is we're hearing from Susan, who is herself a senior and also a rural service provider. The mental and the practical part of isolation is particularly hard for seniors if there are heat or cold crises. Also, no phone, internet, or vehicle. People were unhappy or desperate and not feeling able and not aware to initiate accessing resources. So low-income seniors, people living with disabilities, living in units with no air conditioning and no friends or nearby, those were some of the kind of higher risk populations. And I just want to read that quote, Carrie, if we have some time, because this was, I think, so important. This was from one of the people that joined us from the BC ambulance service. There needs to be a pathway to get people out of harm's way before the ambulance. Once they reach the ambulance, that means they have not reached any of the other safety nets, or worse, nobody found them, and we find a fatality. So that quote really stayed with me from the service providers workshop. Thank you, Carrie. And, you know, within this, there was this amazing counter narrative. So within the senior circles, we had two amazing elders from Adams Lake Indian Band participate. And Indigenous engagement, the province asks us not to do that explicitly because First Nations Health Authority was doing their big study on heat, but we did have some Indigenous peoples participate. And here's what we've heard from them. We had all the supports we needed. The Adams Lake Indian Band kept checking in on us during smoke. They even offered to bring in groceries for us. They were very supportive, and I was glad for that. Obviously, that wasn't the case for all Indigenous elders, and this is a very small story, but it's something to celebrate from the kind of strength-based approach for sure. So social networks are critical to safety. People kept informed, connected, somebody checked in on them. Wellness checks, that was another thing that really worked. So some of the service providers, especially within the seniors domain, would actually call people and check how they were doing. And there was a protocol in place if there wasn't no response on the phone. So that really was really a good success story. And really though, like one of the limitations of this study, something to keep in mind, the people that we engaged, especially as Carrie mentioned, because we worked closely with service providers, these are people that have some access to services. So as an urban and securely house sharing circle participant said, we were all able to get here today. So we know someone. It's the people who don't know where the services are that are in most need. So that's very important to keep in mind. And we have a series of recommendations, and we won't go through them in detail, just in the interest of time. But they're organized by the area of inquiry. But some of the really important things, you could just use this like as a bit of a checklist. Basically, just are we thinking about that, right? Like and basically at the core, big issues like address underlying challenges of adequate housing. That was number one thing that came up, right? Like if you don't have adequate housing, you have very low chances of being safe during heat wave or other extreme events, right? So communicating proactively, really important, that saves lives. So and early, directly, and in coordinated fashion, right? So some of the important things, really having a distinctions-based communication strategy, because it's different. Reaching different populations group is very different. Let's see, some of the important things that came on, this project focused on the extreme heat, but the protocols that maybe your organizations already have for extreme cold and how this could be adapted. When it comes to housing, one important finding was that, we have minimum thresholds requirements for minimum temperature due to cold. What would a minimum temperature due to heat look like, right? So that's a gap provincially that needs to be addressed on. Then the other thing that really came out is the language we use. Like one of the service providers, she was saying, if we put a call out that we have a program for heat vulnerable, socially isolated seniors, well, nobody would sign up. You have to make it fun. You have to be inclusive. You have to be very kind of purposeful in the language you use. So that was a really strong finding for us as well. Carrie, I think I'll wrap it up here, and we'll take any questions now or later.
Yeah, thanks so much, Lily. And I think, we did this research in the spring, and since then we know that the province and health authorities and community organizations have been working on implementing improvements to heat preparedness and response, and we'll talk about some of those steps that have been taken at the end. But if there are any questions specific to this project, we can take them now. And if not, we do have some other great examples of some things that went well, that were done right last summer from Kelowna. And we have some of the representatives from their lived experience circle here with us today as well. I'm not seeing any questions in the chat or any hands up. So thanks, Lily, for sharing that. Again, if you have any questions that come up, oh, there's Rosemary, and Rosemary was really grateful to have you join us today. So thanks. I see your question that temperature in the hallways need to be monitored, as simple as a thermometer. Ventilation flow poor, needs to be monitored. Again, technology can do that for you, yet it's not done. Thank you, Rosemary. A really great reminder that there are things that can be done that maybe don't have to be terribly expensive, that we have the technology. We just need to be able to mobilize some of those solutions. So I'm going to pass it to Stephanie Martin now. She is with the City of Kelowna, and she's joined by two of her colleagues from the Lived Experience Circle on Homelessness, and they're all part of a project called Journey Home. And I was really struck by some of the things that they did last summer to connect with and support different populations to stay safe during the heat. So they're going to share some of their structures of how they did that and some of their experiences with that. So Stephanie, over to you.
Great, thanks, Carrie. Thanks so much for inviting us to be here today. I'm just gonna set up my screen here, so just bear with me for one moment. All right, here we go. Yeah, so my name is Stephanie. I'm with the City of Kelowna in the Social Development Department. So we're joining from the traditional unceded territory of the Syilx Okanagan people here, and I'm joined by my colleagues Elaine and Sherry, so I'll just pass it over to them to introduce themselves as well.
I'm muted. There we go. Unmute. That's part of learning how to be a lived person with Zoom. So I'm Elaine. I've been a part of the Lived Experience Circle on Homelessness since Journey Home was first even dreamt about 5 years ago. And we're going to talk about what we did with the extreme heat, and I'll turn it to Sherry.
Hi, my name is Sherry Landry from the Lived Experience Circle on Homelessness here in Kelowna. My name is Spotted Sage Woman, and I've been on Syilx Okanagan territory since '92, but I'm Dene First Nations from the Gagoti Dene Band, and have been part of LECO for the last 3 years, and it's been an honor working with the homeless.
So I'll just let you two tell a little bit about the Lived Experience Circle on Homelessness, and then I can jump in about Journey Home there.
Okay, so the City of Kelowna undertook a consultation to try and solve the homeless situation. And as part of that, they convened lived experience focus groups. That was about 5 years ago. In the end, we had about 250 people coming, and we just brainstormed over and over and over all the different things. And we all know everything that was said earlier in the presentation, etc., single points of entry, communication, all those things. And then meanwhile, the other side of Journey Home, the more, I don't know, professional part, I guess, was being developed. And together we formed the Journey Home strategy of Kelowna. And so LECO, Lived Experience Circle, is an integral part of that. And we're equal with everyone. We're not an add-on or a beside or a underneath or some such pejorative words as that. So, so that's where we are. And then when COVID hit, we already had formed a lot of circles with service providers that we were represented on. And that really helped when the heat dome happened, because it brought us into being able to have a group to immediately connect with. And I think we'll move on.
Yeah.
Yeah. And
So I don't know if we've got anyone here from Kelowna. I know we have a few from the interior, but I'll just give a little bit of background about Journey Home. It's Kelowna's 5-year plan to end homelessness. And the goal was to create an easy to access and coordinated system of care for people experiencing homelessness or at risk of homelessness. And it was created through partnerships between the city with social serving organizations and people with lived experience of homelessness, as well as cross-sector organizations, businesses, Indigenous governments, and communities. So when we were invited to come here today, we were reflecting on what enabled us to respond well during the heat event. And these were the 4 themes that we pulled out. So I won't bury the lead. Having the structures to work together and partnerships across diverse sectors and organizations was really important for us. Of course, leadership and involvement of people with lived experience of homelessness, having mechanisms for ongoing communication, and having relationships and trust that had been built up over time. So we'll share a few stories or examples of what happened last year, and I think you'll hear these themes woven throughout each of them. So to understand what we did during the extreme heat event last year, we'll talk a little bit about what we did during the pandemic, because we relied on those structures that were put in place there. So when the pandemic hit, shelters had to reduce in numbers, and there was a lot going on so many levels. We were working on a plan to keep people safe. So shelters developed a tiered system where people accessed, or they were assessed over a number of different health factors related to COVID, and then they were placed in different levels of support. So those who were most at risk were put in the safest situation, as long as they weren't at risk of overdose, in hotels that opened up. And then the final tier were those who were assessed as least at risk. And because there was reduced capacity, some people were asked to shelter outside and given equipment to do so. The shelters then took the extra capacity that they had due to the reduced numbers within the shelters to create outreach teams to find people who were sheltering outdoors. And at the same time, we put in sort of a new governance structure as a planning team. So that included Interior Health, BC Housing, the City of Kelowna, Journey Home partners, and then developed some working groups to do ongoing planning. So an outreach circle of outreach operators came together. There was a shelter operators table that was meeting regularly. And then there was the tables that were embedded in Journey Home from its inception that we talked about, like LECO, who became a really important go-between between people who were experiencing homelessness and the organizations that were serving them and the city. There were some other tables that were also active at the time through Journey Home, such as an interfaith circle, which we'll talk about in a little bit. But at the time that the heat dome hit, everyone really knew what their roles were within this structure, and we were solid in how we were working together. So partners were activated through those tables for the heat response. And I think one of the beauties of it was that we weren't just working with the strengths of the homeless serving sector. We were already collaborating with the business community, with faith groups, with developers, with people with lived experience. And so we were able to tap into all of those different resources really quickly. So I'll pass it to Elaine to share an example of from the Interfaith Steering Circle.
Okay. So as Stephanie said, we already had the tables, which really helped. It is reactive when you get a heat dome, not proactive. And in a perfect world, it would be proactive. And here we are again this week, today now getting the reactive. However, we can only keep moving forward and sharing with all levels. So one of the things within 24 hours, we did convene a table of everybody, and we talked, and there was a church that was willing to open up to be a cooling center. It turned out it didn't work out because of some of the things that were identified in the previous conversation. The location was not accessible, and you couldn't, people bringing shopping carts and having to walk a minimum of a half an hour from the closest bus stop in 42-degree weather isn't going to happen. So that only stayed open about 3 days, and it was realized let's move our resources differently. All the outreach teams divided the city up very quickly and said, okay, you go here, you go there. We recruited a lot more volunteers and just went and drove around and gave water. And again, we shared because we had the tables. Everyone was willing to share what they had instead of, oh, that's my water, which was probably a mentality. Not probably, always was. We always had this siloed approach for a long time. And so and it wasn't just people who were homeless, anyone. I was at one point in the Mr. Tent down by the lake, which is a focal point in Kelowna, and anyone walking along was offered water. And some people who were tourists and stuff were like, oh, what? We're like, no, this is for everybody. We don't want anybody to have a heat event. So we had misting tents, we had water, communication. Oh, and then we had some cooling centers. And today, just this morning, the city of Kelowna has reopened quite a few cooling centers. Unfortunately, their hours are, well, they're business hours, let's face it, and the heat doesn't stop at 4 p.m. In fact, the hottest part of the day is 4 to 6, I think. But however, it's a start and it's a beginning. We do have the Mr. Tents. We do have the day use site now, which has a water tank mounted. So water, gravity driven, can come down and people can wash off. Another thing they're handing out now is frozen washcloths, which is a helpful tool. And hopefully it'll work. I don't know that we did that last year. So hopefully it's something that can work and that we can keep giving out. What I would say is that we realized quickly we needed to get out there and be out there and talk to each other constantly. And so that was the biggest learning. And I don't know, Sherry, if you want to add anything to that.
Yes, I think that was definitely the thing. Was the key was collaboration with everything last year. And with that, I think it was very critical with all the with getting the voices out from where and bringing the voices to the table. Like, one thing that always guides me when I go out to talk to the people and bring their concerns forward is, what am I bringing from the community to the circle, and what to prioritize what they say first.
Yeah. Okay.
So I'll just move on a little bit here. We've kind of talked about how people shared their resources and put them on the table. I think that there was trust that was built up over time through the pandemic response that really contributed to being able to do that. And, you know, not having that, we do this, we do that. It was everyone pooling their resources together. We also worked with RCMP and bylaws and other groups that were already going around so that they were carrying water and hats and sunscreen and things like that. And of course, the outreach teams were really important in doing that. The city turned back on water fountains that had been turned off due to COVID, and Interior Health developed protocols to keep them clean. We opened up washrooms where people were sheltering. And of course, a lot of these things had closed down during COVID. The picture here was some cooling tents that got set up near the Queensway Washroom, which is a navigation hub for people experiencing homelessness. And the Queensway Washroom Hub is staffed by people with lived experience of homelessness. So they were also there to give out water and other supplies and be an approachable person for information. And so Sherry can talk a little bit more about how peers have been involved in the response.
What is very important, especially what Stephanie is saying, is getting the word out there. And it is amazing how people stepped up. And that was my biggest fear, was the hidden population, and part of it was like doing the footwork. And that's what was so important, like from the delivery of food to outreach workers being able to call and deliver, because there's some people that don't access these services. And due to whether they're, for instance, when they have more freedom when they're camping out, and some are barred from services, and some just don't have faith in any of the services. The peers really became an important part because it encouraged people to go inside, and they actually they were building a relationship with these people, and it was so prevalent, like within, especially within the Indigenous community. I can speak for, but just for the fact that everybody know, I don't know if it's wide, but I know just from being from Yellowknife and being here since '92, that's one of the hidden populations. And you can see it more and more so out here in Kelowna, how they're getting younger. And I mean, the Indigenous peer navigators at the Parkinson Rec and the library were crucial, because that it had 4 walls, and they can come in and plug in their electronics and use the washroom without any barriers or stigma. And we also, at the Queensway washroom was crucial, because as you know, if you come to Kelowna, there's key hotspots where a lot of people hang, and where they're not forced to move on everywhere they go. And having the peers employed was a big thing, because frontline workers, they are the frontline workers, and sometimes they struggle a bit more because they still are coming out of their recovery and going and trying to do something well. And I think the loss of some of the staff after the funding is over was a downfall, and it was too bad some of these still can go on. And what I really got me was during this time we had to address things aren't overlooked, and this was a story of one of the fellows that I was the honor of visiting him in his home. And when I mean home, and it's respect for all home fires, regardless where they are, whether it's on a street or in a home, and getting that the homeless voice, Indigenous voice out through that home and respecting their space. And with that, the one fella really hit the home to me when he says, overlooked, nothing gets dealt with. And I think that was crucial, because I mean, just hearing those words, it wanted me to just pick his mind even more, and to reach these people through, I know through my own personal, but just because I had the gift of some of the teachings, and going through a recognition of low barrier actions through physical, emotional, mental, and spiritual dimensions, and having not just Indigenous peer navigators, but all navigators, outreach workers, frontline workers were so crucial. And I mean, without them, they don't all realize how much lives they saved. And as a person of lived experience, and having to go out there and doing the site visits, I mean, a lot of people, like I've heard the previous presenter say, is not getting their needs met, right? So, and I found out that the more that we were out there, the more voices were being heard. And what was great was having things that were working come out, such as like the Mr. Tents and the hygiene center, and places where they can cool off and give them back humanity.
Thanks,
Thank you.
Sherry. So keeping people in the system informed was also key, and we heard a lot about that in Lily's presentation. So it wasn't just, what are we going to do, but also how are we going to communicate it to people? And LICO and the outreach teams were on the ground hearing from people about what was working and what wasn't working. Regular meetings were happening that kept everyone informed, and being able to communicate what was happening on the ground with the agencies that were coordinating the services. The picture here is from a survival guide that was handed out, which included things like where water fountains and misting tents were. And, because people were coming to these groups regularly, we had the communication structures to be able to also pivot when there was challenges. And I think that was really a key piece for LICO, to be able to share back what they were hearing from people who were outdoors. I realize we're going over a little bit, so I'll just pass this last example over to Elaine and Sherry, just to quickly touch on some points from the bottled water program.
Okay, so bottled water, the funniest story was right at the very beginning of this. One of our partners jumped on Zoom, and big smile, great guy. He said, I just scored 98 flats of water. He just went and he bought everything he could find in the store, and he shared it with all of us. There was no, this is ours. And he was from an agency. And that was important that we could do that. we also, and it was actually a person from the city who got this going, got a grant, and we now have a project in Kelowna where every time they do water main repairs, they look at, can they put a water filling station as part of it? Because if you already dug the hole, you're already down there, you just have to put a pipe extension and stand it up. We've got quite a few now, and so now one of our projects is refillable bottles and getting them out there, because obviously it's good for the environment, it's good for everybody. Means that people can have access to water without people coming around. So that is the permanent water fountains, and we've got an ongoing commitment from the city of Kelowna to have infrastructure for drinking water. So winter, of course, always has its challenges. It's cold, but last winter we actually got the city convinced that some of the washrooms and some of the water stations were able to be left on because there's ways to insulate. So that's a success, and we just hope that now we're in this next heat wave right now that we can keep doing this, and we just keep doing our best. And thank you for having us and listening to us, and thank you for the previous presentation. It was really good.
Thanks, Elaine. So I'll just, there's a couple of points that I just wanted to end on. In addition to those key learnings, stigma, and I think we heard about this in Lily's presentation as well. It was identified early on by LEPO as a barrier for people experiencing homelessness, but I think it's become really clear, and even this year continues to be a challenge when people aren't feeling safe or welcome to access indoor spaces to cool off, that this is something that we need to be continually working to address. And we've seen the need for ongoing investment, as evidenced by the story of the peer navigators. When the funding ended, one of the centers didn't continue their navigator there. And I think this is really something that can't be a one-off. It needs to be a commitment for ongoing investment to be able to build that ongoing resiliency. And then flexibility, of course. I think we've shown some of the ways in which we were able to be flexible, but as we are facing these challenges that are putting people's lives at risk, we really need to continue to be able to think outside the box and push for new solutions. So thank you so much for listening to us, and I'll just close this and come back to the group for any questions.
Thank you so much, Stephanie, Elaine, Sherry. That was really just fantastic. And I just how you were talking about how quickly you were able to mobilize a response during the heat event. I'm just so struck by how that was only possible because you had these strong foundations of collaboration that I know didn't happen overnight. So just investing in that sounded like it was really important, but also the peer navigator structure itself and having those relationships and that trust in place sounded critical. So thank you again so much. Does anybody have any questions for Stephanie, Sherry, or Elaine about the program there, or how you might do something similar in your community? I have one quick question, and this is for any of you. If there's a lot of housing providers on the line today, and if anyone is interested in starting their own kind of peer navigator or peer sharing group, like, do you have any recommendations for them about how to do that or where to start?
We got a large grant from Health Canada. Okay. So it's a federally funded program, and the funding allows you so the peers, there's a staff person, the peers are recruited, and then they go through a lot of intensive training and cultural awareness and all kinds, and then they're embedded. And the first cohort, we had 3 sites, and then we changed it around to different to try and expose the professionals side of it than the peer side of it to this project, so we can hopefully get more people knowing about it. And we just got another extension, so we're hopeful. But the key is, and as Sherry said, when they ended at Parkinson's, then things kind of went back the way they were, versus the peer who was embedded in the Kelowna Public Library. The library loved the program so much that they went into their budget and they funded that position now. So this is a full-time funded position by library board.
Okay.
So the success was learning and keeping. And now they actually have part-time in a smaller branch library. So, so how to do it? Get money. And then talk to us, because we've done this, and we've learned a lot. I represent LECO on the board of that, and we have learned so much. And it's critical, and the peers are critical in this.
Thanks, Elaine.
And
Yeah,
I'd
sure.
like to say something, I mean, and it's so important, like I said, you have those that are out there getting the voices out and the stories out. And what I found crucial, especially time of the heat wave and in the winter time, was without the frontline workers or those that with lived experience, that way we got raw information straight from the people that did mapping for housing and support. Purpose-built housing, shelter, and services was crucial when we were talking. And then that, I think, and it's funny how you say some things don't happen overnight. When the response to the heat thing, it seemed to happen overnight, real fast here in Kelowna.
Yeah, that's just so fantastic. You can mobilize so quickly because those relationships existed. That's great. We were hoping to hear from others as well. So unless there's any more questions, there might be one in the chat here. I can't see my chat. There we go. Just another comment sharing about how the Vancouver Island Regional Library System has been active in their equity initiatives. Great. Yeah. So just some really good ideas of maybe unlikely partners that you might have not thought of. The faith community you spoke about, but the libraries and others who have cooling facilities or have opportunities to offer other supports.
I had also just put a little thing in the chat because it just popped into my mind. Have we ever, in any of our cities, talked to BC Transit and said, you know what, it's plus a gazillion. Could we have 3 or 4 buses parked, especially near seniors' places, that would just sit there? Like when there's disasters, that's what happens. They bring in buses, like when a building burns down and people sit on the buses while they're waiting to get things organized. Why during this heat waves don't we have, say, you know, a few parked in hard to reach areas? You can get on the bus and sit for an hour and cool right down, and they would have water and whatever.
Yeah, I have heard of some examples, Elaine, of that. And I think that's been piloted in the Lower Mainland in some places. So it's a great idea. And I think it should happen in more places. Absolutely.
Yeah. So Stephanie, you're on this, okay? Go and get money to do it.
So we would we don't have a lot of time. Oh, sorry, Mary, I see your hand. Yeah, over to you first before, yeah, go ahead.
I think it's just a comment, and I'm speaking not in with my United Way hat on, but I'm actually also an ESS volunteer and part of the leadership team in our ESS response in Campbell River, the territory of the Likwita people. And what I'm really noticing is there's not a response right now. ENBC is not getting involved at the moment. Our communities are saying it's not an extreme event yet. And so it's very interesting. We're sort of struggling. It's 36 here today already. We have a large unhoused population and a large seniors population who are at risk. And just the lack of response is shocking to me after what we learned and what you're sharing with us. So I just want to say that it's hard to sit here knowing what we know and what you've learned and also not seeing the response. I know even in Nanaimo, the response from the city of Nanaimo yesterday was we've opened our recreation centers as cooling centers. And we know that that is not going to do what it needs to do for our vulnerable folks and equity groups. So equity seeking groups. I just want to say that out loud because I think it's still something that we have to really work on.
Mm-hmm. Great points, Mary. And I think that is definitely something when we presented our findings back to the province, we presented back to EMBC as well. And I know they've been working on some responses, or changes to their response, but it's not maybe there yet. And there's more work to do. We all know that. So the fact that we're in a heat event right now, I think is a good kind of test of what have we learned from last year that can be applied to this summer. Yeah, thank you. We would love to hear from, I know it's hard when there's 30 people to hear from everybody. So we thought a good way to do that would just to have a brief small group conversation. It's about 10 after 11. So maybe if we could take just 15 minutes and have a small group discussion and talk to each other. I'll put some questions in the chat here that can help guide our discussion, but just reflecting on during heat events, what is your experience of the tenants that you support in relation to some of these themes we've talked about today? So cool spaces, transportation and mobility, communications, and the importance of community or social networks. And then just building on what we heard from the presentation from Elaine and others, thinking about what are some ways that you could engage lived experience to increase resilience of your housing programs? What are some ideas that you've heard today that maybe you'd like to think about? So Courtney, if we're ready, I think we'll just take about 15 minutes and then we'll come back all together for a quick close before we all try and stay cool and support others to stay cool. Okay, so 15-minute conversation and then we'll see you back here. Hi, welcome back. Welcome back, everybody. We had a great conversation, and I know it wasn't very long, but it was just really nice to hear different perspectives on how what we heard today really resonated from different roles within the system. So we don't have a lot of time today to hear back from different groups, but I'm glad we had a chance to connect. We do have just a few minutes left, and we wanted to just share a few resources and tools that have come out more recently, so since last summer. And just make sure everybody is aware of those, and also welcome if there's tools and resources you are aware of that you want to make sure are shared out, please use the chat and you can share some of those. So the first is just, since last summer, I'm sure many of you have heard this by now, but BC does have a new heat alert and response system that is being piloted. It provides some clarity around the triggers and activation process for 2 tiers. First tier is a heat warning, and there's different trigger temperatures for those from different regions of the province. And then the second tier is an extreme heat emergency. So I'm just going to put it in the chat, a link to the new BC Heat Alert and Response Guide. It also provides some recommendations and actions for different levels of government and different sectors, including NGOs. So it's a really, I think, helpful document, and I think we're going to continue to implement and learn from this. So that's one. And then there's a number of other new heat resources and tools that have just been released in the last few months. So the first is from Prepared BC, and it's an extreme heat preparedness guide. I'll put that in the chat as well. That is for, I think, more for the public in general about behaviors and things that they can do to keep cool during a heat event and how they can prepare themselves. The next guide is a new guide from Vancouver Coastal Health, but I think it's a fantastic resource for any region, no matter where you are. And that's a heat check-in support framework. So if you are doing wellness checks for tenants or other populations in your community, it provides some really great tips about how to do that. They also have staff available to do trainings and presentations on this framework. So there's a contact within that framework, and you can find that, I think, if you're in the VCH region. There's a federal framework that also was released this year from the National Collaborating Center for Environmental Health. And that is also about how to do heat health checks. So it provides a checklist if you have staff or volunteers that are out in communities doing heat health checks. And then there's a number of fantastic resources that have been released from the BC Centre for Disease Control, and they are specifically from their harm reduction services. So there's a number of handouts. I won't put every single link in the chat because there's many of these, but we'll send them out. Perhaps Courtney, you can send them out in some of the resources following the webinar. And they have a handout for housing and shelter service providers. There is a heat guide for people who use substances. And there's also another handout on using substances during extreme heat. So some really critical information in there, perhaps for some of the populations that you're supporting. And then last but certainly not least, of course, BC Housing has a whole website with resources for preparedness for heat and wildfire smoke. I will put that in the chat as well. There we go. Yeah, so great resources there. Wellness check-in cards. You can see some examples of these, as well as some posters that you can easily print off and be using tomorrow. The last resource, I'll know we're at time. Last resource I'm going to post is it's really just kind of a cool tool that relates to what we were talking about today. It's a heat and equity mapping tool for Canadian cities. So that was just recently released by University of Ontario, but most medium-sized cities in Canada are on there, and you can look at temperature data as well as where low-income areas and where people live alone. And so it provides some great tools to see where we should be targeting our heat planning and resources if we want to be having an equity lens on that. So I know we're at time, and I know I'll just turn it back over to Courtney to give us some closing words. And also, I think the slides for today hopefully will be made available. So thanks again to all of you participating and to our other presenters.
Awesome. Thank you to Carrie and Lily and Stephanie and Elaine and Sherry and all of the facilitators for the breakout rooms. We couldn't have done it this webinar without all of your support and knowledge and sharing. Always lucky to sit in. The best part of my job is sitting in these webinars and learning things. All of those links that Carrie just popped into the chat will be included in an email sent out over the next couple of days. Once I do some edits to the recording of this webinar as well, this will also be shared, posted on our website, posted on our YouTube channel. So you don't have to keep all these things living in your brain forever. We'll share links and recordings and things as well as the slides. I am also just going to pop into the chat a link to our session evaluation. If you could take a few minutes to fill this out. We love data, we love improving, and we love making sure that we're offering education sessions for you folks that meet the needs of the work that you do. If this gets lost in the chat, it will also be included in that email. So no worries about that. Again, big thanks. If you have any more questions or things, feel free to answer. I'll be the last one to leave. Otherwise, enjoy the rest of your day and stay cool.
Thanks, everybody. Take care. Bye.